Hi, I'm Dr. Rudy Cashman. We're going to have a very interesting program tonight. As you know, my major interest really is the mind and the body. And the real big determinant of how we feel every day really is how much sleep that we have. So tonight I have with me Dr. Atiya, a specialist in neurology and a board-certified sleep specialist. She knows a lot more about this subject than, frankly, than I do. And with that, I'd like to introduce you to Dr. Khan.
Thank you, Dr. Cashman. Thank you for having me here. All of us know how important sleep is. Tell me, as a neurosurgeon, how important is sleep to you, and what do you think about sleep?
You know, it's a very interesting subject. Since you made me read a big book about it, about this thick, I know a lot more about it now, but not as much as you do. You know, I look at sleep as a whole in time. It's a whole in time. I see a lot of patients with it every day now that you woke me up to it, and I can see it now. But so I looked up the definition of it a little bit, and I feel a good definition would be that sleep erects a perceptual wall between the conscious mind and the outside world. And the second part of that definition is it has to be immediately reversible. If it's not reversible, it's not sleep. That's unconsciousness or hibernation or some other definition. But those two things are the mainstay of a good definition of sleep. And with that, let's go on, Dr. Khan, and tell us about what you know and your experience. This is really going to be a fun lecture tonight.
Oh, thank you. You know, people think when we sleep, it's a very passive process. You're just lying there, the brain is sleeping. You'd be surprised how active the brain is. Sleep is actually a new science. People did not know that there were different stages of sleep, that the body goes through different experiences in sleep. When we learn more and more about sleep, especially when we started doing EEGs and brain waves, we realized that there are two distinct stages. One is called REM sleep, which is rapid eye movement sleep, and the other one is called non-REM sleep or non-rapid eye movement sleep. And non-REM sleep is further divided into three stages. When we talk about deep sleep, when people wake up out of sleep and they feel like they are drunk, that's what's called slow wave sleep or stage 3 of non-REM sleep. Now what I want to talk about today is more, you slept, you think you got enough sleep, but you still feel sleepy. And the terminology we use for that is hypersomnolence. Now, you can say, well, what is hypersomnolence? It is excessive sleepiness that disrupts your daily life. Let's say you've been on call and you haven't slept enough. How do you feel the next day?
I'm familiar with that. Drowsy, fatigued, much slower, feel like I've had a drink when I didn't, and it really interferes with my ability to work.
You know, what you said is really interesting because a lot of people are sleepy, but they don't realize the sleep that they need. And they will come to physicians and say, Doctor, I'm tired, I'm fatigued, I have lack of energy. Some people may say I'm depressed. And so using the wrong term or using a term that actually when they want to say sleepiness may lead someone down the wrong path. You want to call it hypersomnolence is when it's drowsiness, when it's not anticipated or not desired. A good example would be if I'm driving, I don't want to be drowsy. So that's hypersomnolence.
That's very interesting because we've all experienced that. I know I had my daughter years ago, drove right off the road. Yes, she fell asleep, her eyelids dropped, and I think she had sleep debt. Tell us a little bit about sleep debt. That to me is fascinating.
Sleep debt is a concept that you have not slept enough and your brain has a debt that it needs to pay. For example, let's say you need 8 hours of sleep, but you only got 4, then that 4 hours is a sleep debt. It's interesting that people think, well, you know, it doesn't matter, I'm so busy. We have become a really 24/7 society. I think it's with the advent of the light bulb. Edison ought to be blamed.
Isn't that interesting?
Yeah. In the olden days, you know, when they had no artificial light, when sun set, you went to bed. When sun rose, you woke up and you managed to get enough sleep. Now with the artificial light, with electricity, it's considered, okay, maybe I don't need that much sleep. Sleep is a waste of time. And so more and more Americans don't get the sleep they need. Most people are shocked when I tell them that you need 7 to 8 hours of sleep. They say, oh no, I think 5 hours ought to be enough. And they say, okay, doctor, if I don't get 5 hours, maybe I can make up my sleep debt on the weekend.
Is it true, Dr. Khan, that you need about 1 hour of sleep for every 2 hours of wakefulness? Is that accurate?
One would say that's about right, because an average adult would need 7 to 8 hours of sleep. And again, it's very age dependent. A baby will need way more sleep, 16 hours of sleep or so. A teenager surprisingly does need about 8 to 9 hours of sleep, even though they'll say, oh no, mom, I'm fine with 4 hours. No, they're not.
Yeah, I've recently read that teenagers need an hour or two more. They really are night owls. They stay up later.
And I will come to that later in my talk, talk about what happens to teenage brains and what happens to their sleep cycle. I want to touch upon how common is this problem. About 0.5 to 5% of the population is actually hypersomnolent or excessively sleepy. And let's put this in a framework. About 20 to 25% of US workers are shift workers. So the human brain wants to sleep at night, but these people have to go to work in the daytime. Even though they can come back home, they think they can get their sleep, but they sometimes are not sleepy in the daytime, and they may experience sleepiness. When we talk about conditions that cause sleepiness, something like sleep apnea, 18 million Americans have sleep apnea.
Wow.
And not all of them are being treated.
Yeah. And that's a very serious problem.
Extremely.
Yeah.
When you talk about what happens when a person is sleepy, what is the, clinically, how do they present? One is people may come in and say, well, I'm so sleepy, I can't really carry on my day-to-day activities. And this may be something like, I want to watch TV with my husband. Well, both of you sit down, and the person who is sleepy is falling asleep. Sometimes people fall asleep in conversations. People fall asleep at work when they should be working and can get fired.
Yeah.
The other thing is, and I have experienced this, if I have been up at night and I haven't got enough sleep, I don't have that much patience. And patients will tell me I'm irritable, I'm moody. A new mother will attest to this. If her baby's up at night and she doesn't get enough sleep, she's impatient, she's tired. You need that sleep for your mood to be optimal. Cognitive dysfunctions can take place. And what do I mean by that? They have found that sleep deprivation can make you perform as though you're legally drunk.
I can believe it. I see patients complaining of memory loss. I saw one the other day, and I think she had sleep apnea, and she thought she had dementia. Yeah, I think I can turn that around.
You know what it is? It's the brain needs sleep to pay attention. You need sleep to get good memory. Now, let's say I'm very tired, I haven't slept, I come home and my husband says, oh, can you run to the grocery store and get me orange juice? Don't forget to pick up the printer paper. Can you get some boot polish? And I'm kind of paying attention. Half the things register, half don't. When I get to the store and I don't come back with those objects, I'll say, oh, doctor, my memory is terrible. Was it really your memory, or is it your ability to pay attention when your brain is tired? When it comes to sleepiness and performance, one of the critical areas is car accidents. The National Sleep Foundation is very interested in this, and they have done several surveys, and they report that 60% of adults who are behind the wheel have reported drowsy driving at some time or the other.
Wow.
And get this, 13% report that they have fallen asleep once a month.
Wow.
I mean, that's a huge...
How dangerous that is.
Exactly.
Yeah.
You wonder these people who die of car accidents, you can't ask them were they sleepy, especially in the early hours of the morning. Probably falling asleep at the wheel was
That's really the problem. I've heard too, even a small amount of alcohol really potentiates the sleep problem.
Absolutely.
That much more readily to fall asleep at the wheel.
Now, the other thing is that in sleep medicine, we always want to ask the bed partners, because sometimes getting an idea of what you do in your sleep will tell me why you're sleepy. For example, a good example is snoring, which may be a hint that you have sleep apnea, but some people will wake up choking, gasping, they are restless, they're thrashing about in sleep. I want to shift gears a bit and talk about what are the causes of sleep. We spoke about sleep deprivation. And that I would consider a physiological cause. That's what you would expect if someone doesn't get enough sleep, that they would be sleepy. In addition, in sleep medicine, we like to think about pathological causes. And those would be conditions that you would go to a doctor to figure out, why am I sleepy? Is this something that I do to myself, or is this a medical condition? When we talk about physiological causes, obviously being sleep deprived, whether you have been up doing surgery at night or because of your lifestyle. Yeah, I know I must go to bed, but you know what? Having a second job is more important to me, working on my computer, watching movies. And so I know I need 8 hours of sleep, but I end up going to bed at 12 and I have to get up at 5, so I didn't get enough sleep. That would be a lifestyle. The other thing would be people who don't have a choice. It's a shift work thing. Some days they're working nights, some days they're working days. The brain can't really shift from this variable sleep time. When it comes to pathological causes, I want to touch upon one very important condition that I see. I see a lot of teenagers in my clinic, and I'll give you an example. I saw a 15-year-old boy whose mother brought him in because she said, doctor, my son has a terrible problem with insomnia. And, I asked the child, what happens? He says, well, I go to bed at 10 and I can't fall asleep till 1 o'clock in the morning. And so I said, what do you do? Well, I know I must get sleep, so I'm just lying there. And then when I go fall asleep at 1, and then I have to get up because I have to catch the school bus at 6:30, so I have to get up at 6.
Yeah. And he's still sleeping, huh?
And he's still sleepy, but he can't. He's very motivated. He wants to go to school. He wants to learn. He goes to school. Guess what he's doing in the first few periods? Exactly. Okay. He comes home. Some days he's so tired, he takes a nap. Then he goes to bed again and can't fall asleep. What is that called? That's called delayed sleep phase syndrome, an extremely common problem in teenagers. What the mother thought was insomnia is not really what I would call insomnia. Yes, it is in the sense that he cannot fall asleep, but his internal clock, the clock that tells him go to bed, the clock that tells him wake up, is shifted forward.
His circadian rhythm is off. That's where the word came from.
That is what it is. Circa means 24 hours, and what you do in 24 hours. Your internal clock, which is in our brain, in the hypothalamus, it tells us, okay, time to go to bed, time to wake up. In teenagers, they have a biological propensity that their clock shifts forward, and we call that delayed sleep phase syndrome.
Yeah, I understand that there are about no more than 10,000 cells in this very tiny little center above our optic nerves at the bottom of the hypothalamus that regulates our biorhythm. And I just can't imagine how they ever discovered that. And it's very small area.
It's in a small area called the suprachiasmatic nucleus.
Yeah, very
and
interesting.
the major stimulus to controlling that clock is light.
Interesting. Very interesting.
Right. Sometimes you'll see the opposite, where people have what's called advanced sleep phase syndrome, where people will fall asleep too early and then they wake up at 3 in the morning, but they actually went to sleep at 7 or 8, and now they wake up and they're like, oh, I can't fall asleep again. So I think I need a sleeping pill to help me fall asleep. When you take a history, they got their 7 hours of sleep, but they fell asleep too quickly. Their perception is that, oh, because I stayed up from 3 in the morning, I'm so tired, I have to go to bed at 7.
They think they have insomnia and don't.
Right. You know what the problem with this is that teenagers who have delayed sleep phase syndrome, they end up performing very badly in school. Because early in classes, before lunch classes, they are so sleepy, they're just fighting sleep. By the time afternoon comes along, their brain is now awake to learn, school is over.
What do you tell them to do?
So what did I tell my patient?
The
critical thing is schedule. When I asked this patient of mine, okay, what do you do on Friday night? He said, oh, Friday night, well, I'm not sleepy, so I don't go to bed till 1 or 2 in the morning. And what do you do on Saturday? Oh, I wake up at 12 in the afternoon, and the mother goes 12. He would sleep till 3 in the afternoon if I let him. And the same thing on Saturday. So what do I tell my patients? Set your schedule. Do the same thing on weekends that you want to do on weekdays. If you want your brain to wake up in the morning, then you have to have the same schedule. Very important. And the terminology we will use is chronotherapy. The other thing you can use is light therapy. If you get bright light early in the morning in your eyes, it's going to wake you up.
Yeah.
So one trick which is very good in summer, I tell my patients, is get up, go for a run around the house.
Yeah.
That bright light in your eyes will not only wake your brain up, it'll make
Yeah.
it easier for you to fall asleep at night.
Okay.
Now, sometimes in desperate cases, I will give medications. And it's a pact we sign that I'm going to give you medications for temporary help. Maybe something like a sleeping pill to help you fall asleep at night, something to wake you up in the morning so you're more alert.
Uh-huh. Very, very interesting.
But can't emphasize enough, the key is schedule.
That would apply to me, wouldn't it, if it's possible.
If it's possible.
To go to sleep the same time every night for most people.
Very, very
Yeah.
important.
Yeah.
You know, we in sleep cycles, in sleep circles, we talk about sleep hygiene. And one of the key elements of sleep hygiene is schedule. You
Yeah.
don't want you to do
Yeah.
different things on different night. Your brain just
Yeah.
does not like that.
Yeah. Make a very dark room, same time, soft music.
Use the bed only
Yeah.
for sleep and sex.
Yeah.
You know, people bring
Yeah.
in all
Yeah.
their daytime worries. They
Yeah.
bring in their schoolwork. They bring in their
Yeah.
work to the
Yeah.
bed, and then it's a stressful situation. You want to relax, you want to wind
Yeah.
down, you want lights out, you don't
Yeah.
want television exciting you,
Yeah.
you don't want computers there.
I found that reading helps me fall asleep. And what I found out now, actually, since the brain uses so much oxygen and ATP, your energy molecule breaks down and secretes the end product is adenosine, and adenosine makes you sleepy. And 10 minutes, bang, you're asleep. Is that true?
It's very true. And guess what acts on the adenosine receptors? Caffeine.
Uh-huh.
So when people say, I drink coffee to wake me up,
Yeah.
it's true because
Yeah.
adenosine receptors will be blocked by caffeine.
I'm guilty of that for sure. Now I know the reason. Thank you.
I want to talk about one other common condition. When I say common, it is very much undiagnosed. It's something that I see in the sleep clinic. People are not very aware of this condition, and it's called narcolepsy.
My father had it.
Oh, I did not know
Yeah,
that.
yeah, he did. Interesting.
Let me ask you this. How old was he when he was diagnosed?
And I don't know if he ever went to the doctor about it, but I could see it. He ran a deli, and he'd come home, from his deli in New York, be on the subway, and he'd fall asleep on the middle of the afternoon and stuff like that. I'd be sitting in the deli, go back there, and he'd be just totally knocked out 1 o'clock in the afternoon. So I don't think he ever went to a doctor. Sleep is a fairly new specialty.
Absolutely.
It wasn't really, there then, but when I think
Right.
back about it now, he really did have it.
Well, when we talk about narcolepsy has four associations or four major symptoms. The most important, and for some people that may be the only symptom, is excessive sleepiness. Sometimes it's so bad, they call it sleep attacks.
Yeah.
So they got 7-8 hours of sleep at night,
Yeah.
and then they're in a situation where they should not be sleepy, and they have an irresistible desire to just fall asleep.
Yeah, he used to just like that.
Like
He'd be
that.
talking to you in the conversation, boom, he'd be fast asleep.
Now
And
that's
it-
that's abnormal
Yeah.
sleepiness.
Yeah.
I mean, anyone
Yeah.
in conversation
Yeah.
with you should not fall asleep.
especially his son, who's not giving him any trouble.
Exactly. But another symptom of narcolepsy can be cataplexy. And what is cataplexy?
Yeah.
It's when someone has a strong emotional situation. Most commonly laughter, but
Yeah.
it could be sad news.
Yeah.
They feel a sensation of weakness. They feel as though they are paralyzed. Some people are so dramatic they will actually fall down.
Yeah.
Some patients will tell me that they have to hold on to something or their jaw will sag. Cataplexy is very specific for narcolepsy. If I hear this, I'm very suspicious that my patient has cataplexy. I had a lady the other day, and she was telling me that she experienced it in many situations, if she heard a joke, if she was sad, but she was even experiencing about having sex.
Is that right?
And to her, that was just humiliating. She said,
That'd
Doctor,
be quite understandable.
absolutely.
Yeah.
The third symptom that can be seen is sleep paralysis. And what is sleep paralysis? You wake up from sleep and for a few minutes you can't move your body. It's very frightening for a person because they're fully awake, they're fully conscious, but they can't move a muscle.
Interesting.
A fourth symptom that's seen is hypnagogic hallucination. and that is you're awake, but you have fragments of images, hallucinations, fragments of dream, if you want to think of it that way, showing up when you're awake.
Yeah.
You know, when you think about it, narcolepsy is really parts of sleep showing up when you're awake. You shouldn't be asleep when you're awake, you have attacks of sleep.
Yeah.
You shouldn't dream when you're awake, you have dreams. In REM sleep, our body is paralyzed. And so one manifestation of REM sleep is showing up when you're awake. Suddenly you're paralyzed.
Yeah, the word REM means rapid eye movements, doesn't it?
Right,
And that's sort of the fifth stage of sleep. And they even see it in babies. Understand, if you look at a baby, 50% of the time, then REM sleep.
REM sleep is very important, and I think there wasn't that much knowledge about REM sleep, but now people are realizing how important it is for learning, how important it is for memory consolidation.
They think, I've read in Dement's book that he wonders if REM sleep is not maybe when the brain grows in babies, and we dream in REM sleep. That's the most interesting part. That's when we're dreaming, is that right?
We have the most vivid dreams, the most visual dreams. When you wake up in the morning and people are chasing you, and that's probably REM dream. We dream in non-REM sleep too, but they may be more like thoughts, ruminations.
But the good stuff is in REM sleep. Huh? It happened this morning. Boy, it scared me.
Now, you know, the thing about narcolepsy, it is a primary sleep disorder, but the important thing to remember is it is treatable.
You understand they're good drugs now, huh?
There are many drugs that can be used. They can be used to treat your sleepiness. There are drugs that can be used to treat cataplexy. So definitely, if someone suspects they have narcolepsy, definitely it ought to be addressed.
Yeah, I never did see cataplexy in my dad, that he thought he was paralyzed. But no question that he had narcolepsy. He'd fall asleep at the dinner table.
Yeah, I was giving a lecture to a medical student, and one of the medical students told me that his dad had cataplexy, and he said, Dr. Khan, it's so bad. When I call home, the first thing I hear is this crash. And I said, well, is he that happy to hear from you, or is he just...
It happened maybe during an emotional episode.
Absolutely.
The phone would drop. Yeah,
the phone would drop, his dad would crash to the floor, then he would get up and talk to him.
Interesting.
So,
Sleep's interesting. It's
extremely.
The brain is not asleep when we're asleep. The brain is working.
Yes. In babies, actually, we call REM sleep active sleep, because the brain waves look like you're awake. It's that active. Another condition that's fairly common is restless leg syndrome. And a lot of your audience may have experienced restless leg syndrome. It's a condition in which you get abnormal, unpleasant leg sensations. It's a creepy, crawly feeling. Typically, it comes on at night. There's a circadian pattern to it. They don't have that many symptoms in the morning, but they're much worse in the evening. And as the night goes on, they start feeling better. When they move about, they feel better. You know, patients may say, well, if you have restless leg syndrome, why would you be tired the next day? In extreme cases, I've had patients tell me that the feeling is so bad, they have to get out of bed and just pace about for 2-3 hours. Just can't.
I've had my patients tell me that, and it gets confused with back problems. You know, some think they've got a spinal problem with pressure on the nerves, and that's due to the leg symptoms. And some get operated on mistakenly, where people think that that's the cause of, the symptoms. In reality, it's restless leg.
Right, and I'll speak to spouses, and they'll say that there's constant leg twitching going on in sleep. And 80% of patients who have restless leg syndrome, they will have what's called periodic leg movements of sleep, and we see that when we do sleep studies. The thing about restless leg syndrome is it may be genetic. So I've had patients where grandma had it, mom had it, the child has it. It can even start in childhood. And then there are certain medical conditions which cause restless leg syndrome. A good example is kidney failure.
Is that right?
Yes. Another example is iron deficiency. And as part of our evaluation for restless leg syndrome, I do some blood work. I would check your kidney functions. I look for conditions that cause peripheral neuropathy. I would definitely look for iron levels. Because by treating your iron deficiency, I may be able to improve your symptomatology.
Yeah, it's interesting.
Yeah. As physicians, sometimes we'll prescribe medications to patients, and patients may feel sleepy because of a side effect of the medication. I'm a neurologist and I very often prescribe seizure medications. And one of the common side effects of seizure medication is drowsiness and sleepiness. So they say, well, I'm fine in the morning, I take my medication, or for the next 1.5 to 2 hours, I'm extremely sleepy. People take over-the-counter medications.
Yeah, I see this a lot in my practice today. That kind of, especially elderly patients, they're taking 7, 10 medications, and they're wondering why they're drowsy in the afternoon. You know, they really have to be careful the amount of medicine that they take.
Right, and I think that it's very important, because before you start doing things like operating heavy machinery or getting behind the wheel, make sure that it's not your medication that's causing you to fall asleep. Similarly, medical conditions can cause people to feel really sleepy and tired, and this could be conditions like heart failure, or if your thyroid is not functioning optimally, or kidney dysfunction. You know, people think with depression, very often people have insomnia. They'll say, I can't sleep and it's my depression. But sometimes with depression, you sleep too much. And so if you are very sleepy, going to a physician, your general medical practitioner, to check if you have one of these conditions. Could be anemia, could be heart failure. If your thyroid is low, you could be excessive.
Do you see it with emphysema? I think a lot of patients I see smoke with emphysema. I always thought they're much more drowsy. Is that true or not?
Definitely. Patients with COPD.
With the CO2 levels up, that makes them drowsy.
Absolutely. I see that with my patients who have brain conditions. Brain tumors.
Oh yeah, that's my first symptoms. I see patients with brain tumor. I say, I see been sleeping excessively, or he or she, and very common symptom.
And it may be affecting the area of which controls sleep, or it could just be because of raised pressure. Sometimes I see this in patients who have stroke. That they were fine before, but now they're constantly sleeping.
Sleeping all day.
In your elderly patients with dementia, it's not uncommon that they just sleep the whole day away. So looking for conditions which can cause pathological sleepiness would be very important. I do want to address one very important condition, and that's obstructive sleep apnea.
I tell you, I'm looking forward to this part because it's so important. I think we doctors just totally underdiagnose it. And I'm so glad you, as a specialist, come along and really teach us about this, because I think it's quite common and is not picked up a lot of the time. I bet that's your experience.
It is my experience, and the good news is that the lay public and physicians are becoming more aware of this problem.
I think so too.
I think with the awareness that obesity predisposes to sleep apnea, people are becoming more aware. People are getting to understand what is apnea. When we talk about apnea, what does that mean? Apnea implies stopping breathing. A typical adult would breathe about 12 times a minute, so every 5 seconds they take a breath. We define it as apnea if you don't take a breath for 10 seconds. Hypopnea implies that there is partial opening of the airway, but effective air exchange does not take place. So what happens? You know, what if you don't breathe? What if you miss a breath? Well, most people just don't stop breathing for 10 seconds. They may not breathe for 40 seconds. They may not breathe for a full minute. Well, normally when we are breathing, we have air exchange. Oxygen goes in, carbon dioxide goes out. In most patients, when they have sleep apnea, there's an obstruction of the airway. Typically, it's not at the level of the nose, although it may be. Typically, it's at the level of what we call the hypopharynx, from behind the nose to the top of the trachea. And there are multiple causes. It could be that you have gained so much weight that there's not enough space in the throat. It could be that genetically, your airway, your face is such that you're predisposed. You have a big tongue. In children, very often, I see big tonsils, big adenoids as a cause. Having a crowding of your teeth, having a small jaw, these are predisposing factors. You know, if someone wants to know, well, who's predisposed? Someone who is overweight, who has central obesity. A BMI greater than 30 is definitely a risk factor. In males, wearing collar size greater than 17.
I read that in your PowerPoint. That was interesting. 17 is the answer. Okay.
And then medically, there are certain conditions where I'll be thinking, could this person have sleep apnea? If you have hypertension, that's really difficult to control. You're on 3 blood pressure medications. You can't control it. Think, could you have sleep apnea?
Yeah, I think that's where it's missed many times. Yeah, where people have hypertension, heart disease, and the causes, or even leg edema. I read.
Yes.
You can have very swollen legs, and the answer is sleep apnea. It's not general vascular disease, anything like that at all.
Yeah, you know what? The interesting thing is that sleep apnea has an impact on your whole life, including your sexual life.
Yeah.
I mean, when my patients come in and they want to discuss these aspects, and I'll say, well, you know, let me ask your wife. Well, you know, she moved out long time ago. She's sleeping in the guest bedroom, or she kicked me out, and I'm sleeping in the guest bedroom. Erectile dysfunction
is common. And the noise they create breathing like this. I mean, this throat's got to do 3 things, right? I mean, you got to eat with it, you got to put air through it, and then you got to breathe with it. But it's not really built for all that, is it?
No.
And that's the reason for the problems.
And the quality of life, not only for the patient, but for the spouse.
Yeah.
You know, maybe the person's lying there and snoring, they don't realize what they're doing. The spouse is lying there thinking, oh my God, can't sleep. They're exhausted.
A huge social problem.
It is very big. People are embarrassed to admit it.
Perfectly understandable.
And sometimes to them it's such a relief to bring it up. And to the spouse, they're like, oh, can you do something about it?
Yeah. And you can do something fairly friendly. You know, it's a wonderful thing of these sleep labs that we see now, especially in Fort Wayne.
You want to go? Yes, absolutely. But the important thing is, for one, to realize there's a problem. Number 2, get it evaluated. Go see your physician. People want to know, well, what are you going to do about it? Well, first thing I'm going to do is take a history. I'm going to figure out, why are you sleepy? Is it your habit? You only sleep 5 hours. How can you expect that you should feel fresh? Or is it something to do with your schedule and your lifestyle? Or do you have sleep apnea? Do you have restless leg syndrome? Do I think it's a medical condition? So a good history is very important. A good clinical exam is very important. Because if I see big tonsils, they're almost touching each other, I can offer you treatment surgically. So we use objectively, we use something what's called Epworth Sleepiness Scale, and that tells me how sleepy you are. For example, if I say, well, you know, are you likely to fall asleep while I'm having a conversation with you? Well, that's abnormal. A hint would be I walk in to see my patient and my patient is fast asleep. Well, that's typically not normal. You don't fall asleep while waiting for a doctor.
I have. No, I'm just kidding. I'm just kidding. Maybe some of my patients have. I hope not. Once, though, all my 40 years of practice, one told me they read a whole book. That's very rare.
But I will tell you this. I saw a child. He was 7 years old, and I diagnosed him with narcolepsy. The first 3 clinic visits, I never saw the child awake. They would walk into the room.
Is that right?
He would go lie down, and he would be asleep. It was only after the 3rd visit, when I had him on medications, I said, oh my God, this is the first time I've seen this child awake. So profound sleepiness. For some patients, not every patient, but we do laboratory testing. And this may be something like a polysomnogram, which is a sleep study. Or it may be something like a nap testing called multiple sleep latency test. And for rare patients, I will do blood work. I mentioned iron deficiency for restless leg syndrome, and I might check for that.
Now, in your center, you have all these things set up, right? Where you can run all these tests from EEGs to EMGs, and you watch them all night in severe cases,
yes. People say, well, what's going to happen when I do a sleep study? What happens is that you come in usually 1 to 2 hours before you normally go to sleep, so we can prepare you for the test. Most of the time, these bedrooms are fairly comfortable. They're like hotel rooms. We test variables like brain waves. So we will stick electrodes on your head. We look for muscle movements.
She meant to say place, not stick. It doesn't hurt.
No, it doesn't hurt. They're placed, yes. EMG, we want to see limb movements, so there are some chin electrodes. The electrodes on the legs and arms. We want to measure chest movements, so we will place belts around your chest as well as your abdomen. We want to see what happens to your oxygen in sleep, so you have what's called an oximeter. We want to look at what happens to your heart when you sleep, so you'll have EKG leads on. It's interesting that some people will have so such degree of hypoxemia or their oxygen level will drop that they start having cardiac arrhythmias. And so we will pick this up during a sleep study.
I even read in Dr. Dement's book that, because he watched many patients over the years, but he mentions he had a few patients where the heart would completely stop and then start a few seconds later. I mean, it's not how dangerous sleep apnea, you know, is. And,
every year I hear of some patients who died because of sleep apnea because they were not treated. There are famous cases of athletes who have died and had sleep apnea.
Is that right?
Yes.
Yeah.
So
especially football players and
big guys.
Yeah.
Yes, absolutely. So the thing is, the sleep study is used for multiple sleep conditions, but we individualize it to the condition we are looking for. For example, in young children, we want to see what their carbon dioxide level is. We may not monitor that in an adult, but we definitely want to monitor in a small baby. So it's
you bet.
Yes. I want to just touch upon what's multiple sleep latency test, because when I mention this to patients, they're like, what? This is what we call a nap test. And what happens is a patient comes in, they get a night study. So they get a sleep study. Why do we do a sleep study before we do a nap test? Because I want to make sure you got enough sleep at night. Then when we do the nap test, we are trying to see, are you still sleepy in spite of getting adequate amount of sleep? And this is how we diagnose narcolepsy. And what happens is that the next day the patient is told, okay, go to sleep, and this may happen 4 or 5 times. It's done every 2 hours apart. And we see how long does it take for the person to fall asleep. And then we also look and see if they get any REM sleep or not. Now, normally a person who's doing a nap test, maybe after lunch, they might feel slightly sleepy and maybe they might fall asleep on one nap, but it's not normal to fall asleep on every nap. So a person who falls asleep on every nap, that's pathological. And if we average out how long it takes, and if it's less than 8 minutes, then it's definitely abnormal.
Interesting.
And the other thing we're looking for is REM sleep. If you see REM sleep on any of the naps, then that's definitely abnormal.
Excessively sleepy.
Excessively sleepy. So you may not have to have the nap testing. For most of your sleep patients, the only test we would do is the polysomnogram or the night testing. But in some patients who I suspect may have narcolepsy, I might go ahead and do the nap testing the next day.
Very interesting. And what percent of the people do you think you get well in the sleep center? Suppose you have sleep apnea, and how do you treat that? How do you treat it?
How do you treat that?
Yeah.
I'm going to. Well, if the concern is weight, I would definitely recommend weight loss.
Okay.
Okay.
Send them to my weight clinic. My wellness center, we have that.
Which I think for most people is easier said than done.
Absolutely. That's why I'm writing a book right now. I'm almost done on motivation.
On motivation.
35 chapters.
Here's the thing. You have sleep apnea, you're exhausted.
Oh, yeah.
You're motivated. You're motivated to diet.
Yeah.
You're motivated to exercise.
Yeah.
You're too exhausted.
Too exhausted.
The other thing,
excellent point.
Yeah. The other thing is that there's a link between obesity, eating, and sleep apnea. And it's actually really very exciting research. There are 2 main hormones that control your appetite. One is called leptin, and the other one's called ghrelin.
Yeah.
Leptin is produced in the fat cells. It goes to your brain and says, okay, you're done, you're full. It's a satiety hormone. It says stop eating. Ghrelin is produced in the gut and it increases your appetite. So there's an interplay between leptin and ghrelin in how much calorie intake we will take. Now there's very interesting research that's emerging on sleep apnea and what happens to your leptin and ghrelin. When people are sleep deprived, their leptin levels go down.
Doesn't turn the appetite off anymore.
Exactly. So you're consuming extra calories.
Eat more. Yeah.
And put weight on.
Yeah.
The other thing,
I think it's called leptin resistance, like insulin resistance. I was reading about that because I do a lot of lecturing on weight control, and it's leptin resistance, isn't it?
Leptin resistance commonly seen in sleep apnea.
So
you may have high levels of leptin, but still you're eating because your receptors are resistant.
Interesting. Yeah, very interesting.
So You want to lose weight?
Yeah.
Treat your sleep apnea, go to sleep.
I gotcha.
That's the best way to
Yeah.
diet, sleep and lose weight.
That's the best one, but also use some procedures and some things you put on their nose and things to improve them also.
Yes, and that's called continuous positive airway pressure.
What percent of the patients need that?
It depends. If you have sleep apnea, and we'll talk about sleep apnea being mild, moderate, and severe. Mild would be, the way we classify that is how many times an hour do you stop breathing. So let's say I do a sleep study and we figure out that you quit breathing 10 times an hour. That would be considered mild. Up to 5, we will accept. Anywhere from 5 to 15 would be considered mild. 15 to 30 would be considered moderate. And if you quit breathing more than 30 times an hour, that's severe sleep apnea.
I have heard some people stop 100 times an hour.
Yes.
What's the highest number you've ever
What have I seen? 140 times an hour.
My God.
And sometimes, you know, the number is
God.
not...
Can you imagine watching a DVD of this person the way sleeping? I mean, it's got to be a war.
Right.
There's got to be a war going on.
Sometimes the numbers don't look so bad, but when you look at how long they quit breathing, they don't breathe for 60 seconds. So they should have taken 12 breaths. They haven't taken one.
Yeah.
The other thing is how much does your oxygen drop?
Yeah.
You know, it's going into the 60s, but just think of the brain being oxygen deprived.
Yeah. Have you ever been tempted in your sleep lab when you see this to run into the room and resuscitate them? Have you ever been tempted to do it?
Well, the time that technicians will run in and wake them up or rush them to the emergency room is if they start having ventricular arrhythmias.
Yeah, I can see that. Heart arrhythmias,
Right. So it really depends on, you know, CPAP is an excellent treatment. Not every patient is willing to accept that.
Yeah.
They say, well, is there anything else I can do? Certainly surgical options are there. There is a procedure called UVPP where they cut the uvula. They may cut part of the palate to create more room. Dentists can give you devices where the tongue can be pulled forward, the jaw can be pulled forward to create more space in the back of your throat so air exchange can take place. You know, the old-fashioned treatment used to be positional therapy. You've noticed if you're lying on your back, you snore much worse than if you're on your side. So you just tell the wife, okay, put a tennis ball, sew it in the back of the T-shirt,
and
every time you're on your back, it's going to hurt so badly.
So you move.
Right.
See that? My wife does that, then I'll know.
But going back to your question, CPAP, that is considered the gold standard of treatment.
I wondered about that. I was asking.
And some people will tell me, you know, doctor, I tried it in the past and it didn't work for me. Now they have newer machines. They have much more comfortable masks. They are masks that go into the nose, in the nostril, which is called nasal pillows. There are masks that cover just the nose. There are other masks that covers the nose and the mouth. So there have been a lot of advances.
What does it really do? What does it really do?
Okay, when you think about obstructive sleep apnea, there's an obstruction. Your throat is collapsed.
Okay.
You somehow want to open the throat so air can get in.
Gotcha.
Okay. If it was collapsed so you could not get in, one extreme way would be to do a tracheostomy. You bypass.
I read that. They used to do that years ago. It was very effective. But nobody wanted it, and I don't blame them.
Oh,
I wouldn't want it.
Would you want a tracheostomy?
No way.
But in cases where patients were going into heart failure because of sleep apnea, you had no choice, tracheostomy.
It turned their lives around.
Absolutely.
And some people just accept it because, God, they were energetic, they were awake, and they're working again.
Well, when I tell my patients that, they're like, no way. I said, yes, that used to be the treatment. But what happens with sleep apnea, CPAP, is it's a continuous positive airway pressure. So you have a throat that's collapsed. So mechanically, air is pushing your airway open.
The machine is blowing air through your nose and opening it up.
Exactly.
Okay.
You know, they say, does that machine have oxygen? No, it's not oxygen. Your lungs are fine. They'll take care of the oxygen exchange.
Yeah.
It just needs the air to get in.
Yeah.
So it's positive airway to open your...
Do you have a tank, or does it just get the air?
It's a compressor. It's a small machine. It's very sleek, and the machines nowadays don't make much noise. They have humidity in them, so the air going in doesn't dry your throat. They are really quiet now. People were concerned that the machine would make noise. it's very comfortable.
I've seen patients who do it and they don't complain about it at all because it feels so much better. Yeah.
Oh, my mother, she said it turned her life around.
Is that right?
Yes. She said last night she came to Fort Wayne, she traveled by train, and Amtrak has ports, and she used it in Amtrak.
Oh, isn't that wonderful?
So she's, you know, an ideal patient. You take it wherever you go.
Yes. And she had a daughter who made the diagnosis, I bet you.
She said I turned her life around. So.
Isn't that neat? A neat story.
You know, when it comes to sleep apnea, I really want my patient to be careful while driving. I don't want them
I understand
to fall asleep at the wheel. I've had personal experiences with friends who fell asleep at the wheel.
Yeah.
And that's the one thing I will warn repeatedly. Don't get behind the wheel. If you're sleepy, pull over and sleep. There are medications I can give you. FDA has approved medications that can be given to patients who have sleep apnea, and they're using CPAP and they're still sleepy.
Yeah, thank you for bringing up that point, because from speaking with you and reading Dr. Dement's book, from wakefulness, if you're a little bit drowsy and your eyelids are dropping to total unconsciousness, it's like that.
Oh,
just like that. So it's so dangerous not to pull over if you feel sleepy. I've done it. I felt sleepy, and one time I was driving on the wrong side of the road, and my daughter went off the road. And it is extremely dangerous.
Extremely.
And you have to respond to that feeling quickly, pull over. And I can't emphasize that enough.
Very important.
Yeah.
You know, even in employment, when we have patients who drive trucks, there are special requirements for them for using their CPAP.
And what to do,
How many hours are they using, how compliant they are, we have to fill out forms.
And are people driving a truck with CPAP?
Well, if they have sleep apnea, they should be treated.
Yeah, of course.
And a sleep physician has to certify that they are awake enough to get behind that monster truck.
I'm glad you got the job.
No, but think about it. You know, if you're sleepy and you're cranky and your life is affected, your interpersonal relationships are affected, can you be a good parent if you're tired?
No. And I just have to admire mothers today with 2, 3, 4 children. That you know, they all sleep deprived, and no wonder that I see them for what I call mind-body diseases a lot, from fibromyalgia to headaches to sleep apnea. It's a sleep apnea in the sense it's a mind-body disease. It's on my list of mind-body illnesses, and they have to be very careful. You
know, when you think about all of us, you're a parent. I'm a parent. When I'm rested, something that my child may do, I'll be very tolerant.
Right.
If I'm sleepy,
it's almost, unfortunately, normal not to be in the best mood and be a little.
And this is across all
irritable.
ages.
Yeah.
You have a child who's sleepy and they show up in school. They are hyperactive. They don't pay attention.
They don't learn as well.
They don't learn as well. They're labeled as ADHD, learning disability. And really, in fact, they have sleep apnea, which is a treatable condition. The other thing is untreated sleep apnea has a higher risk of high blood pressure, higher risk of stroke, higher risk of heart disease, sexual dysfunction, diabetes. You mentioned metabolic syndrome, and higher risk of dying suddenly, unexpectedly.
Let me ask you this. What does sleep really do for you? That seems like a simple question. What does sleep do for you?
That's $1 million question.
You know, I understand in the Dement's book that they're really not so sure. But a few things we do know. Yeah.
We know it's important for memory.
Yeah.
We know it's important for learning. During certain stages of sleep, do you throw out unnecessary information and consolidate what's most important? There are lots of interesting research. When you take people and do learning experiments, people who are allowed to take a nap and get adequate amount of sleep, and people who are not. And then you teach them something new. The ones who were rested, got a chance to take a nap, are able to retain new information. So during sleep, you lay down the framework, the wiring of what you learn, what's important, and throw out what's not important. It's important for immune function. People who are sleep deprived are more likely to have a higher risk of infections. It's important for your hormonal secretion.
And the infection thing, I noticed that 2 years ago when I had no partners and I worked day and night. It's funny, like Saturday afternoon, I'd start getting much more sleepy. I was, sleep deprived, and I pick up like the 24-hour flu, which some people are thinking really is sleep disorder. That's not a virus. The other thing I noticed also, what I've been reading, every cell in your body seems to have a cycle of rest and activity, so it's important. And your mood in the morning definitely is better when you've been rested. I think we've all noticed that. Is the memory better in the morning?
I'm not sure whether it's better in the morning, but if you're sleep deprived, it's not good.
That's a good answer. And,
I mean, males ask me, does sleep affect erectile dysfunction? Now, here's the research on that. 69% of men who have sleep apnea have erectile dysfunction, as opposed to 34% who don't. Okay? And treating the sleep apnea improves that.
Yeah, I'm sure they're very, very thankful. They're very thankful. And I understand that all mammals need sleep. I understand a horse needs about 4 hours sleep. Your cat needs about 16 hours of sleep. But we need about 2 hours for 1 hour of 1 hour of sleep for 2 hours of wakefulness. But I notice I'm getting a day older. I seem to need a little less sleep. And is that normal?
Sleep quality changes as we grow older. Probably your overall requirement is still about the same, but your sleep may be a bit more fragmented. You may desire to take a nap in the daytime when you didn't earlier. You may find that you wake up a little bit more. So overall, the duration does not decrease, but in 24 hours, but it may be a bit more fragmented.
Insomnia. Now, there's transient insomnia. That's just a few days. That usually clears up, doesn't it? But then we have chronic, where it lasts for a long period of time, which probably is a lot tougher to treat.
Yeah, insomnia is the term we use when people can't fall asleep or they can't maintain sleep. And so you may have a sleep initiation insomnia where you just can't fall asleep. You may have sleep maintenance insomnia where you wake up repeatedly. And then you may have what's called terminal insomnia where you wake up and then you just can't go back to sleep. There are some people who are predisposed to insomnia. As they get older, they seem to experience it more. They will say it runs in my family.
The whole family's awake.
As they got older, they had insomnia. The other thing is, some people say, well, I have insomnia, but they may actually have, like I said, restless leg syndrome, because they feel, is it really you got out of bed because you couldn't sleep and then paced about, or it's you got out of bed and had to pace because of your legs and thought that it was insomnia.
I was reading the top 10 causes of insomnia, which I thought was interesting, like your comment, that pain, they mentioned number 1. Coffee and alcohol being number 2. I've been guilty of the coffee deal. You got to get off of coffee 6 hours before you sleep, or maybe not drink it at all, because, matter of fact, if you have insomnia problems, you probably shouldn't drink coffee at all. Isn't that right?
Or if you're going to drink it, then stop drinking it up. Don't drink any after 3 p.m. Because some people are extremely sensitive. And that's a very good point. But people say, well, I have to drink coffee to stay awake because I didn't sleep good. How much caffeine did you consume? And is that what's impacting your ability to fall asleep?
And emotional upset has, of course, a great impact. If you take our problems with us in the evening, how it's tough to sleep. An interesting one, too, is the room can be too hot or too cold. Like my wife, it's always too hot, and with me, it's always too cold. And it's back and forth, and that can affect sleep pattern. And of course, stress has tremendous effect. Illness, indigestion. If you go eat out and have a big meal at 9 o'clock, and you expect to go to sleep right away, that could be a problem. I've had that same thing because being a doctor, I eat late a lot, which is not a good thing, but that's the only time I do have to eat. And unfamiliar environment can also, I think, interfere with inability to proper sleep.
You have to go to sleep in a hotel. You have a big important meeting coming up. You have to present, but like the hotel bed, the mattress is different. Absolutely. And, when it comes to temperature, most people sleep better at a slightly cooler temperature. But again, if the bed partners are boring.
And you have the right kind of blankets and get that little cave, you're much more likely to sleep, no doubt about it. I have noticed, so that you do keep the noise out of the bedroom, don't turn the TV on, have a book there, have it be dark. I mean, just no light except maybe a pen light or a reading light. That is induces sleep a lot more. That's helped my little, I had a touch of insomnia from just being too busy. Too busy a mind, I think, interferes with sleep, and I sure suffer from that. and you have to really quiet that fella down.
You know, sometimes what I'll tell my patients is if you have these thoughts or things you have to do the next morning, keep a pad by the bedside.
Yeah.
A moment that comes into your mind, don't ruminate. Write it down.
Write it down. And
So
put it away. It's
put it
gone.
away. You're going to think about it tomorrow.
I think it's a good one.
Yeah.
I think that's a good one. Soft music seems to help, I think.
For some people, they use kind of background.
Best one I ever saw, I would listen to the waves of the ocean. And I thought that was, I had a patient walking one time, he had that problem, and I remarked upon it. He insisted I take the CD home. I said, you need it more? And I know, you got to take it. So I took it, I use it at home. It was really quite good, very effective. And I think it's been a very nice discussion of sleep, and your lab is available for people to come over and
Absolutely.
and see you and get a good screening.
Yes.
And the majority of people probably you can get well with a conversation and a little talk about it without doing a lot. I'm quite sure of that. But I really congratulate you on bringing us aware in Fort Wayne of sleep and problems in sleep apnea because of the accidents that occur, the illnesses that we see, hypertension, heart disease. I've seen people with very swollen extremities from the heart failure when in reality it's sleep apnea. And you really woke me up to it. I know you handed me the book 3-4 years ago, and I did read it, and I just reread it again.
It's the quality of life.
Yeah.
It's the quality of the patient's life, his family's life, her family's life.
Yeah. And I think it's something that's not brought up at every doctor's office, but they certainly are learning a lot more about it because you're a specialist here in this area on this subject.
Well, Dr. Cashman, I congratulate you for bringing this awareness to the public.
And well, thank you. It's part of, mind-body illnesses, that I teach. I've got a number of DVDs, and this will be one of them. This DVD here we did today can purchase at your office. But I'm a doctor about the mind and the body. Frankly, I'm a neurosurgeon, but I have a number of DVDs here connecting the mind and the body. Here, for example, is a 1-hour lecture, what I call mind-body illnesses. I took this with me recently to Boston in a publishing course I took there. They loved this DVD. They really liked it. I have one on pain control, for example, which is very important, and I've given a lecture on that on Monday, actually. And I have one on for your patients with sleep apnea on the diet. I have a DVD and a book, actually, on proper eating, not a diet, proper eating, one for children, and for adults. And I have a DVD out coming shortly on the psychology of eating, another one on motivation, how to motivate us to wellness, because I give all these talks on wellness, but then again, a chiropractor stood over one of the meetings and he said, well, that's fine, doctor. Your advisor would tell the patients, but how do you know they're going to do it? It's a good question.
Well, can you motivate them to get better sleep?
And I certainly know where to send them and diagnose them much better. I must say I really enjoyed this conversation with you, and I hope we do some more of this, and I hope I'm sure this is a great benefit to your patients, and I hope you show them this DVD.
Thank you very much.
Them better.
It was my pleasure.
My pleasure to have you here.
Thank you.
Yeah.